A little bit of a glitch and hang up of time, but howdy, folks. John Adamson, the rehab and documentation guru. I had to really think clearly about saying it like that. It's been a while since I've used that moniker, and I got to get used to using it again. So I made the switch. I posted a video that I was switching, then I posted a video that I switched back to the rehab and documentation guru from Seeking Light. Got a couple comments from, especially from one individual who said liked the content under Seeking Light, basically, but was glad I was getting back to Rehab and Documentation Guru, and asked a question about what about getting into industrial rehab? Any suggestions? Well, I'm going to plug a friend of mine, someone, well, I've had contact with, and it's been a while since I've talked to her, but somebody who I really think has a pulse is doing something that's up. And if you don't know who Meredith Cast is, STIN, she is the non-clinical PT. That's the name of her web channel. She's got a huge Facebook group of 44,000 people for rehab professionals. It has slightly different titles, like the non-clinical rehab professional. I forget all the details, but you can easily find her on Facebook because her group's so large. But she has some courses that help therapists get into non-traditional roles for PTOT and speech, even as assistants. And so that would be like a good place to start in terms of looking at her course offerings. I know she has a few. I know they deal with transitioning into a wide variety of types of fields. But I do have some things to say about just leaving clinical practice and going into a non-therapy role. Like, what might you consider doing? Well, finding out basically the anatomy of what makes that field tick. So, um, I'm looking up a lot right now on environmentalism. I know that sounds strange, but it's something I have an interest in a certain aspect of environmentalism. And so I'm looking on the X platform. I'm signing up to, follow multiple people who have clear, huge followings in their respective fields of climate science and environmentalism and clean energy and things like that. And it's fascinating because it's opened up a whole new world of information that I didn't have readily at my fingertips. I kind of knew some things to look for, but they're giving me keywords. And that's important. Keywords. If you know keywords, you can pretty much Google anything and get down the right path. One of the things that makes me effective at finding out, let's say, coverage under a policy for certain items in therapy, even if I don't know the insurance company very well or their policy, I know the keywords that would pull up the policy, if that makes sense. So something like, let's say, industrial rehab, I know there's humongous groups out there that do industrial rehab, and finding the keywords that are concerning to them would be important. Next, I would just talk to the employer that's going to be hiring me in that particular field, in this case, industrial rehab, and ask them specifically, what are your primary concerns? Can you give me a bulleted 5-point list of your primary concerns that you're seeing? So in this case, she had mentioned ergonomics. So obviously, it's work-related injuries is a big concern. And so, another aspect of like getting up to speed on something like that would be going to Google Scholar and just typing in search options like workplace injuries. Just use those keywords and then see what articles pull up. Try to narrow your search within the last 5 years. And what you will find is probably some of the best evidenced data to support how to prevent workplace injuries. Some of it will be therapy related. Some of it may be machine building, design. I'm just, spitballing. I have no idea. And what that will do is it'll start to help you focus on, okay, what are the things I need to focus on as the therapist? Especially when with your already knowledge of things like, anatomy and kinesiology and body mechanics. And the other thing I would do is look. carefully at like how much force production is needed for certain maneuvers. So, for instance, I remember back in the day when I would teach ergonomics, I think this is still accurate or appropriate, is that if you held a weight right next to your body, all that was on your back was essentially that weight. But if you held it out at arm's length, that was a factor of times 10, something like that. I might be off, but anyway, so finding out key concerns, especially when it comes to like force impact on different movements, will make you more valuable. Like you see somebody it's doing, also looking at like repetitive motion disorders. What are the key movements that bring about certain repetitive motion disorders, like let's say lateral epicondylitis? So keeping those things in mind. The other thing you might consider from a work environment is, look, you might be focused on as a, I think she said she's a PTA. You might be looking at like physical, but look maybe at really increasing your knowledge on foods that are anti-inflammatory. Because I'll tell you what, one thing I've learned, and this has been partly on my own body, is that there are certain things that make me more predisposed to inflammation, and then certain things that reduce my inflammation. And by reducing my inflammation, I'm less likely to hurt myself, especially with repetitive motion, because repetitive motion will tend to cause microtrauma, which will cause inflammation, which will lead to debility. Well, if I'm accentuating that inflammation by my diet choices or lifestyle practices, then that's valuable information that I could also impart. And not that nutritionists, and obviously, if you're maintaining a therapy license, you're not giving nutritional advice. And you could always preface it by saying, according to WebMD, these foods are known to be anti-inflammatory, or avoid these foods to reduce your inflammation. So all you're doing is you're providing information from somebody that has a license to provide that kind of information. But you being more knowledgeable in areas outside of therapy may help in that particular role. And as far as documentation goes, in that particular um, venue, doing workplace ergonomic and injury reduction, that type of thing, what would be helpful? Well, I mean, you could probably go as basic as the SOAP note. Subjective, patient or employee was hurt doing X, Y, Z. Objective, analyzing what they were doing on the job that caused the outcome. Analysis, finding ways through your education that they could have improved that performance. And then a plan, which may include not only the behavior of the employee, but also the behavior of the company, might be really helpful. Just some thoughts. So again, starting off with Meredith Caston, I'm doing searches in the industry, like on X platform. Go to Google Scholar, key search words that will, just delve you into that world. And documentation, maybe starting off with something as easy as the SOAP note format, may help you in that realm. Just saying. Anyway, hope you're doing well. Thanks so much. Take care and God bless.